Okay, so I think we'll get started rather than waiting for more to join. And if people join, they can jump on. So I just want to welcome everybody to our Spotlight on Adults Social Care webinar. Before we begin, I just want to cover some housekeeping. So the session today is being recorded and will be available on demand on our HMY Careers Hub website. To help with the smooth running of the session, we have disabled delegates' videos and microphones. But if you do have any questions during the webinar, do please pop those in the chat box, and our colleagues that are on the call will do their best to answer those questions during the session, and we'll also have a little Q&A towards the end. So my name is Tina Jenkinson and I work for the Humber and North Yorkshire Health and Care Partnership as Careers and Employability Manager. So the Humber and North Yorkshire Health and Care Partnership formed in 2022 and comprises of NHS organisations, local councils, health and care providers and voluntary community and social enterprise organisations. The partnership is one of 42 new integrated care systems which cover England to meet the health and care needs across a geographical area. They coordinate services and plan in a way that improves population health and reduces inequalities between different groups. So we work across a geographical area of more than 1,500 square miles, and we serve a population of around 1.7 million people, all with different health and care needs. So our area includes Hull, East Yorkshire, York, North Yorkshire, North Lincolnshire and North East Lincolnshire. So in order for us to meet the health and care needs of our population, we need to ensure that we have an appropriately skilled workforce reflective of the communities that we serve. So this is where my role comes in as Careers and Employability Manager. So my role is around developing that talent pipeline and inspiring and growing our future workforce. And one of the ways that I do this is by delivering these Spotlight on webinars to showcase the range of great careers that are available in the sector and highlight the variety of different routes and pathways in. So I'm delighted to be bringing you this webinar today to shine a spotlight on careers in adult social care and the variety of pathways into the sector. So adult social care is a really vital part of our health and care system. It's about supporting people to maintain their independence, dignity and control. And this includes providing personal and practical support to help people live their lives. So social care workers support people with a range of disabilities and dementia or mental health conditions, and they could be working in a care home in the local community or from someone's home. So we do need to do more work around recruiting more people to the adult social care sector to meet demand, and we currently have around 4,000 unfilled vacancies across Humber and North Yorkshire. So in today's session, we're going to have an introduction to adult social care, and then we're also going to hear from some of our professionals that are working in the sector. So I'll start by giving a bit of an overview and our workforce data. So feel free to pop your answers in the chat, but I'd be interested to see how many people you think work in adult social care across Humber and North Yorkshire. So we have currently around 50,000 whole-time equivalents working in adult social care across the Humber and North Yorkshire region. Again, how many unpaid volunteers do you think that we have working in Humber and North Yorkshire supporting our adult social care sector? And I'll give you a few seconds to pop your answer in the chat. So we have somewhere in the region of 127,000 volunteers working across Humber and North Yorkshire, which support our adult social care workforce and wider health and care workforce. And that equates to around 5,600 whole-time equivalent members of our staff. But it's not just about the numbers of staff we have in our teams, it's also about understanding the demographics, the context and the needs. So what do you think our adult social care staff turnover rate is? currently sits at around 29.6%. So we have approximately 4,000 vacancies, meaning that 46,000 of the 50,000 posts we have across Humber and North Yorkshire are filled, but we do have those vacancies. So this slide just highlights that we have, again, it's just highlighting that we've got about 50,000 workers in our adult social care workforce. And again, only 46,000 of those posts are filled. So it is just sort of trying to highlight the number of vacancies that we have. So there's some really good opportunities out there for anybody wanting a career in that sector. So looking at the workforce projections and looking forward, so if the adult social care workforce grows proportionately to the projected people aged 65 and over in the population, then we're looking at needing to increase our workforce by 26%, so to around an extra 13,000 posts by 2035, sorry, and that is just across Humber and North Yorkshire. We're just going to look at some of the job roles that we have in adult social care and where some of our gaps are. So we do employ registered nurses within adult social care. And at the moment, we have around 50 vacant posts for adult social care nurses. Currently, we don't have any adult social care nurses under the age of 25, so we do need to do more around creating that younger talent pipeline of people coming in. And over 40% of our nursing workforce in adult social care are aged 55 and over, so obviously coming towards the end of their careers and looking towards retirement. So we do need to do more in attracting younger people through and developing that pipeline. We employ occupational therapists within the adult social care sector, and we do have a shortage of occupational therapists and occupational therapy assistants. And again, currently having around 25 vacant posts across Humber and North Yorkshire. We also employ social workers within adult social care. And again, we have vacancies there, and currently there's around 50 vacant posts for social care workers across the patch. And again, we need to do more on recruiting not only younger people into the workforce, but also we need to attract more males to work in the adult social care sector as well, with 85% of the social worker workforce being female. And our biggest area and the biggest struggle to recruit to at the moment is our care workers. So our care worker post, we've got about a 10.2% vacancy rate, and that equates to around 2,800 vacancies. And again, only 12% of care workers are under 25, with the average age being 42. So again, it's just highlighting that we do have around 4,000 vacancies that need to be filled in adult social care. That was just a bit of a flavour of some of the roles. Obviously, there's so many more different roles within the sector, but we're going to talk through some of those today, and we're going to hear from some of the professionals who are doing those roles to really highlight what the role involves and those different pathways to get into the sector. So I'm going to hand over to my colleague Debbie Foster from East Riding Council now, and Debbie's going to talk about adult social care within a local authority. So over to you, Debbie.
Thank you. Hi everybody. So my name's Debbie Foster and I work for Adult Services and Health in East Riding. So Adult Services is quite a big directorate, and we consume quite a lot of the council's resources in providing services for all adults over the age of 18 who have particular needs. So working in the care sector can be very rewarding for the right person. Depending on the role, you don't always need qualifications or relevant work experience to work in social care. But that being said, we are committed to providing great learning and development opportunities so that career pathways and progression can be achieved. What important is really to us is having the right values to work with adults, treating people with dignity and respect, and being caring and kind. Next slide, please, Tina. So I always love them slides. That is actually who we are. All those people that are in front of you showing their superpower, they're all our members of staff. And then all the other slides are all of our service users who all took part in a promotion that we did to recruit in adult social care. Next slide, please, Tina. So not all jobs involve personal care. Adult social care is all about offering personal and practical support to help people live independently. You can support lots of different people, including adults with disabilities, those with mental or physical health conditions, as well as older people. The aim of social care is to support people to have the best quality of life that they can have and to help them maintain their independence, dignity, and their control.
Have you ever wondered about adult social care in the East Riding of Yorkshire Council? Let's talk about it. Adult social care is an essential service that supports older people and those with disabilities. It's about enabling people to live independently and with dignity. In the East Riding of Yorkshire Council, they provide a range of services, including home care, residential care, and day services. They also have a dedicated team of social workers to provide support and advice. Did you know that the council has a Dignity in Care campaign? It's all about promoting respect, dignity, and compassion in care services. So, whether you're an older person, someone with a disability, or a carer, the East Riding of Yorkshire Council is here to support you. They're committed to providing high-quality care services to those who need it most.
So my role as a Care Careers Coordinator means that I'm responsible for facilitating work experience opportunities and career pathways within the adult social care sector. Engaging with young people is vital in introducing young people to the opportunities in care and working collaboratively to look at the many potential career paths available. There are varied routes, which include some of those shared on the slides, like apprenticeships, T-levels, work experience, and taster days. But like I said before, we are also committed to providing continued professional development to upskill and to retain our employees and colleagues within the sector. We fund and support learners through multiple qualifications, such as the Level 3 Education and Training and the Level 5 Diploma and Apprenticeship in Leadership within adult social care, helping us to grow our own managers from within the sector. So we're upskilling the next generation of leadership and we're driving career progression throughout the care sector. Next slide, thanks.
Welcome to our conversation on work experience, apprenticeships, and T-levels. Did you know that 90% of apprentices stay in employment after completing their program? Work experience, apprenticeships, and T-levels provide a direct path to employment. They offer a practical approach to learning and equip you with the necessary skills for your chosen career. Adult social care is a crucial sector that requires skilled workers. By 2035, 1 in 4 people in the UK will be over 65, increasing the demand for adult social care workers. East Riding of Yorkshire Council is committed to supporting these initiatives. We offer a range of programs and support to help individuals access these opportunities. So, whether you're starting your career or looking to upskill, work experience, apprenticeships, and T-levels are valuable options to consider. Contact us to learn more.
So I think really just want to highlight that working in care can be a fulfilling and rewarding career. No 2 days are the same. It's recession proof with employment opportunities. We have career progression opportunities. It's a job that really matters. We can offer flexibility, and there are a variety of job roles. And I think in conclusion, really, working in care provides job satisfaction and an enormous sense of personal achievement from knowing that your job is helping people.
Thanks very much, Debbie. That was really interesting to hear what's happening over at East Riding of Yorkshire Council and those opportunities available, and really great to see that there's some real people out there. Those superheroes are those people that are currently employed and working for East Riding Council. So next I want to hand over to Tracy Hopkinson from Springfield Health, and Tracy's going to talk to us about career pathways at Springfield Healthcare. Over to you, Tracy.
Hi everybody, my name's Tracy. I'm the Talent Acquisition Lead for Springfield Healthcare. And we discovered that people thought that if you came into care, it was one job and you remained in that job forever. So we decided that we would create a career pathway. So if you were new to care, you could start off with our youth academy, you would do some mandatory training, you would then progress. We've developed your soft skills, which you will need to go out in the industry, and then we would do some shadowing, give you the care certificate. You'd get our induction that we have, any specialist training. If you wanted to work with people that had got dementia, we would give you the level 2 in care, which was fully funded by ourselves. From there, if you've decided that this is the career for you, which we hope you will, and then you can go on and you can mentor and coach other new people that are coming into the industry. So you would go through an additional set of 6-week training program, and you would act for a mentor from anybody from the ages of 18 to, I think my oldest care worker at the moment is 73. So, you would be there and you would be helping and mould care workers of the future. If you decided that your interest was more of a clinical way, you could do your level 1, level 2, you could have interventions for people, and you would be able to do a little bit more of the specialisms in clinical support. If that is, sort of where your heart is, then we could do what we call a nursing associate program. So you wouldn't have to go full-time to university to become a nursing associate. You could actually do that while you are doing the job. You would have to have a minimum of 12 months experience under your belt as a care worker, and then you would complete the foundation degree course, and then you would do some clinical placements. We have some clinical customers that we have, so you would actually be working with the people that there is a possibility that you've actually already established relations with, because you've looked after them from a care worker point of view as well. So then you would be able to become fully trained to deliver, sort of future clinical requirements for our customers. Have the next slide, please. Okay, so from actually starting off with us, the career path that you have is quite extensive. If you wanted to remain on your level 2 and you just wanted to be the care worker, that's what you've always wanted, that's absolutely fine. But the majority, we as a family, Springfield, like to promote from within. So all our branch managers started off as care workers, they became care coaches, they might have been supervisors, and then they've stepped up into the management of the branch, become registered managers. From there, it may be that you've become, as I've become regional, so I look after several different branches, and from regional then you become on the senior management team, and from there, the possibility is that you could become director of the company. Okay, so can I have the next slide, please? Okay, from our youth academy, we were visiting schools and colleges and identified that quite a number of the students that were actually doing health and social care didn't actually flip that into the industry. And I think it's possibly because they were not fully aware of the day-to-day things that we do in the care industry. So we created the Youth Academy, which goes into the schools and colleges and universities and actually gives presentations and training on actual scenarios that we experience as care workers. We work very heavily with students that are doing the T-levels. You know, when we started the programme in 2022, sort of 95% of the students went into retail, which for us it is devastating because they are the potential care workers of the future that's going to look after your mums, your grandparents, you know, possibly any children that you may have. But in 2023, last year, we were really successful in the fact that every single student on the T-level course actually was offered a position with their placement. So you can see that health and social care is becoming the industry to be in. It's the biggest growth industry that you have in the country. You know, not all superheroes wear capes. We know that, you know, and we know that we can train skills. That's fine. We can't train people to be kind, and we can't train heart. And if that is the quality that you have, irrespective of age, irrespective of gender, you know, this is the career that you need to be in. If you can look after our customers the way that you want your family looking after, then it's definitely the career for you guys.
Oh, that's great. Thanks very much. Yeah, thank you, Tracy. That's really great. And I think it's just really interesting, isn't it? Just to see those career pathways that actually a career in care can lead you to all sorts of different opportunities and right up to director level, if that's something that people are aspiring to achieve. So next, what I want to do is go on to hearing actually some stories from people who are working in the sector. So we're going to hear from our support worker.
Before I turned 18, one of my family members got diagnosed with Parkinson's, and I looked after them whilst studying alongside for my university course. Doing care allowed me to have a lot of flexibility with looking after my family member, but also studying and working to have doing the job that I love. My current role is office-based, but I do go out and care quite a bit still. I chose care because I'm going into nursing, so it was a great pathway for me to start out. I'll be prepared because of the job I've done in care, learning medications and how to look after people properly. So it works out well for me for the future that I want to do. I love meeting the service users and spending time with them. And hearing their life stories. If I'm honest, when I first started, I didn't think I'd be 100% in as much as I am, but working for how long I've done it now, I couldn't really imagine doing anything where I'm not looking after the elderly or vulnerable people. I couldn't imagine not doing it. Once you get into a role and once you get into the rhythm, it's really worth it, and you meet some amazing people along the way. So I think just do it. Choose care, change lives.
Hi, my name's Sean and I'm going to show you around Orchard Court. Let's go. We're in the accessible garden, so if you're in a wheelchair like me, you can get around, and it means all the other residents can come together, and we have parties and where we do barbecues, and we do load of games and be together for a couple of hours and do a lot of stuff really.
The buildings itself are like set up to be independent flats, but they have communal areas as well, so they're like a little family that they do get together.
We have karaoke as well. My best song is Wait For Me.
So they don't miss out on a social life because they still have that here.
Let's continue the talk. This is the conservatory, which is not very big. Got summer house in the way, which we all did fundraising for. The staff are doing a skydive. I think they are, anyway. So that should be awesome.
When it comes to the relationship between the guys and us, it's more like a friendship. It's fun. We get up to just anything anyone else would get up to, and we get to go together, and we get to get paid for it. So what's better than that?
So the talk continues.
When it comes to support, no guys are the same. So, for example, if they want to go to the pub, the cinema, we would go with them to the little mundane tasks that we do every day, like making a pack up for the next day. We would support them to do that. If they want to make it themselves, we'll just be there next to them, just encouraging each step rather than doing it for them, and they get so much out of it.
Now you find me in my home, which is very accessible. I can move about and play my games, and it's nice to have my own space when I need it.
We just encourage them to be as independent as possible. The achievement that they get out of that gives you a complete different outlook on your own life, and you go home knowing you've made a difference and feeling good about yourself. It's a good job.
That's talk over. Bye. Go on. Go on. Go on.
Change their lives and yours. Become a support worker.
The Nursing Associate role bridges the gap between healthcare support workers and registered nurses. They deliver hands-on, person-centred care across a range of clinical and social settings. Tracy works in a nursing home for adults with physical disabilities. As a nursing associate, she supports the nurses and care staff. Before her training, Tracy relied on her instincts when caring for the residents, but as a nursing associate, she can now apply her clinical judgment to provide evidence-based care. Becoming an NA has shown Tracy that there are opportunities for professional development in social care. Her journey, like many other NAs, demonstrates a well-defined career path from healthcare support worker to nursing associate. Now she's in this role, the nursing home has been able to reduce their use of agency staff, so Tracy and the team can deliver consistent person-centred care. To find out more about the nursing associate role, search for Nursing Associates on the HEE website.
Please, could you make my brother bigger so he could join the police force? Yours sincerely, Richard, age 9.
I wasn't going to be a nurse, I was going to be a police officer, but I was only 5'6", so I've been a nurse for 40 years. And around me now I've got an amazing team of nurses, and we even grow our own.
I trained as a nurse and then I was a mum and then I went to work as a postie and lots of people kept telling me, Maddie, you're a nurse.
I started working with people with learning difficulties when I was about 13 years old. I just came in and talked to people. It just feels natural. Got offered a college placement to go to a nursing home to look after the elderly. Nobody in the class wanted to go. I said I'd try it and I am still there 20 years later.
I came into care with nothing, no qualifications, never worked at a nursing home. I learnt on the job.
I was a hairdresser, dancer and did drama. I was not going to be a nurse.
It's your heart now, Brett. I can do it through your shirt. You've got a nice thin shirt on.
I went from being a care assistant to do my nurse training, to being a senior nurse and to now being a clinical lead nurse managing a team of nurses looking after young adults with disabilities.
When we see potential in our care staff, we support them to become our nursing associates and nurses.
So what is a nursing associate? We're the bridge between care assistants and registered nurses, and we can use our knowledge of both to promote real quality of life.
There's an extra layer of communication, understanding, belief.
With the knowledge that we've been given, we're here to make a difference to the people that we care for.
I hope I make a difference in somebody's life every day.
The decisions that I make daily enhance people's quality of life.
There's nothing better than making somebody's day.
Getting that smile, that laugh, that flicker in their eye.
I get paid in smiles every single day.
They look after you like you were one of their own family. They do everything that you want doing.
They may feel a lifetime older than me, but we have that connection between each other. Right, there you go, my friend. And that same heart that beat in them at 20 is still beating in them now.
The nurses make a vast difference. They're a great asset to the place. They will do anything to help you.
We just bounce off each other, we support each other, troubleshoot, but have fun at the same time.
Not only do we look after the people that we care for, but we look after each other.
The joy of this job is that everybody learns something from everybody every single day.
I care about them as individuals. I know their family background, I know their previous occupations. I can talk to them about the holidays that they enjoy.
Making those people feel safe in that nice circle of security. It's better for them, it's better for us because we're not having to take them to hospital every time a crisis arises.
Wet your whistle a bit, won't it? That's it.
Knowing and understanding the people we support gives us the ability to make the best decisions by working closely as part of a multidisciplinary team of GPs and other healthcare professionals in the community.
My previous experience is 22 years working in the NHS, and I've brought all of those skills with me into the care home setting.
It's about bringing the clinical side and the emotional side together.
Using our clinical expertise with the people we are experts in.
I'm just going to clean your eye. They get, and I get, fantastic value from that personal relationship.
They are my family, and I want to be here for them.
I know what's right with them and I know what's wrong with them and I know how to get the best out of them.
Which is why I love my job and why I love being a nursing associate.
I am not just one nurse. I have to be a different nurse for every different person I see.
Some people want you to be more tactile, some people want you to be more formal. I have to adapt myself to each different person from what they want from me.
Lots of people say, oh, you've retired, you're not a nurse anymore, it's a soft option, easy life. Wrong.
I haven't come here to take it easy.
It's not just dishing out paracetamol and making cups of tea every day.
We use the full gambit of our clinical expertise every single day to look after people with really complex medical needs.
And as well as that, we also make the tea.
1.5 sugar.
What we do is not just nursing in social care, it's nursing.
Some days, this job hurts.
But sometimes it's good to hurt, because it shows that it matters.
They care, and they care with their hearts, and I'm so grateful. They are absolutely first class.
Thank you very much.
Not all nurses wear a uniform.
And my mum says only ruffians and sailors have tattoos.
It doesn't matter if you work in a hospital, the community, or a care home.
We're all part of the same team and we're all kicking the same way.
Nursing is not a job, it's a way of life.
It's about being there at 4 o'clock in the morning. It's about being there at dinner time. It's about being there at night time. It's about them being heard.
For me, nursing is all about being the best person that I can be to help other people be the best person they can be.
I used to have a spanner in my hand every day as a mechanic. I never thought I could do this.
It's not just care,
it's our career.
So we need people with the skills and the character that maybe don't realise how great and amazing they could be to be tomorrow's nurses.
And if you've not thought about nursing in social care, think about it.
So why me? Why not me? You can train on the job, earn while you learn through the apprenticeship scheme.
My daughter wants to be a nurse. How amazing is that?
I'm proud to work in social care.
I'm proud to be a nurse.
I love it when people ask what I do.
Because I can see
I'm a nurse.
And I thoroughly enjoy it.
I love being a nurse.
I'd have been a rubbish police officer.
these are the things I love, not just giving out tablets.
Hopefully that's given you a little flavour around that care support worker pathway and nurse associate into nursing. I'm hoping that Claire has managed to join us now, so I can hand over to Claire Sharp to talk about the pathway as a social worker in adult social care.
Hello. Gosh, that was so emotional. I absolutely loved those videos. It made me feel so proud. So my name is Claire, and at the ripe old age of 46, I've just qualified as a social worker and working in adult social care. I never thought I would ever be in the position I'm in today. I started out as a mum, as a wife. I worked around my children as they were at school, and it actually started off volunteering for a charity who provided support to families with young children, and I absolutely loved it, and people used to tell me that I was really good at it, and it was literally that experience and knowledge that I gained through my volunteering that landed me a job with East Riding Council, first as a family practitioner in children's services, leading on over the years into adult safeguarding. At that time, I wasn't sort of a qualified professional. I was a care coordinator, but through that, I gained so much knowledge, so much experience, and got to develop my my skills and knowledge through loads of training opportunities. And then the social work apprenticeship, the degree apprenticeship came along through the council, and I thought, well, I've got nothing to lose. And I applied and I was successful, and 3 years studying. So I worked and studied at the same time. I got paid a full-time wage, and I graduated in the summer with a first-class degree, and I'm now working as a qualified social worker in a team called Futures Plus, who support adults with learning disabilities to live their best life. And it is amazing, and I pinch myself every day. Do you want to go on to the next slide? So in terms of my day, no 2 days are the same, and that sounds like a real cliche, but that is really the truth. You know, some days I can be sat trying to catch up on paperwork. Other days I'm out going shopping with one of my service users and supporting them to understand budgeting or writing a shopping list. I can be in a room full of professionals doing a review and advocating for my service user and making sure that they are the most important person in that room and that their voice is heard over and above everybody else's. Sometimes I can be supporting a service user to agree a tenancy on their first home, setting up their bills, or I might be on duty and, you know, helping to manage a crisis that's come in for, say, a family or one of the adults we're supporting. And it's literally amazing. And throughout every single job I've had within social care, what I have experienced is amazing people. I've worked in amazing teams with amazing colleagues who have the most amazing sense of humour, who support each other without fear, without having to be asked. And yeah, it feels like one big supportive family, and that's from, you know, one end of the spectrum to the other, and would include the people that we support within that as well. And I would say that, you know, that the videos we've just been watching, that's what it's all about. It's supporting service users to be the best they can be and to have the best life that they can have. And it is amazing. And if you get the opportunity, I would absolutely say go for it, because I'm 46 and I finally know what I want to be when I grow up, and I'm there and I'm doing it.
That's fabulous, Claire. Thank you very much. That's really interesting to hear your pathway and taking that slightly different pathway and coming at it later in life. It just shows that it's never too late to pursue a career in care. So next we want to go on to hear from Emma. Emma has gone from role of a carer to a director. So here we go, hearing from Emma.
Carer to director, Emma Smith encourages others to look at a career in social care. My journey started when I was 14 and I would go with my mum to the care home where she worked. I enjoyed speaking to the residents, playing board games and helping out. I did this for a couple of years and it cemented my career path. I knew I wanted to help others live happy lives. I began my first job at Bernardo's when I was 17, looking after a young boy with multiple and complex learning difficulties, providing the family with respite. I started with the East Riding of Yorkshire Council in 1999. I took on a number of jobs supporting children and young people with educational, social and physical needs, firstly within a nursery and then within a special school, helping children to develop communication skills and independence living skills, and engaging with them with social events in the local community. I also worked at a children's centre in Driffield, where I coordinated a buddy scheme for children with learning disabilities in school settings. I worked for Bridlington and Driffield Mencap Society as a regional manager, where I developed support in the local area, including opening a charity shop providing employment opportunities for people with learning disabilities. I then went on to work within the day service team for people with learning disabilities. After 3 years, I moved on to become a team manager for a residential service supporting 14 residents with learning disabilities. After 2 years, I moved on to become a registered manager at the Old School House, which cares for people with dementia. During this time, the council supported me to complete my MSc and carry out research into therapeutic engagement techniques. As my journey continued with the council, I progressed to become a service manager of 6 residential units, shared lives, supported housing and community services. I became the strategic lead for specialist mental health and learning disability services in 2019, before becoming the director of adult specialist services. I never started a career in the care with the ambition of becoming a director. I've always been driven by the desire to support other people, and the journey has been a very fulfilling one. Could you care? The right personality, values, natural abilities, and your compassionate approach to a situation or problem are a huge asset when working in care. Do you have patience, empathy, discretion, self-motivation, and genuinely care for people? These skills are valuable, and it's never too late to consider a changing career.
That's great. Hopefully that has given you a flavour of the different job opportunities within adult social care and the different pathways. I think there's a huge variety there, and we've just really tried to capture some of those at the different levels, just to give you an idea of what is possible. We've just got some information here around the Prince's Trust programme that's been run in partnership with North Yorkshire Council. So if anybody is looking at working within adult social care and wanting some support, either with CV writing, training, team building, interview techniques, then our colleagues over at North Yorkshire County Council can support anybody aged 16 to 30 to help them progress into a career within health and care. There are some contact details on the slide for Jenny, who coordinates that programme, and these slides will be shared and available on our website as well. So if you want more information about that, you can access that through the website. So on to any questions. If anybody has any questions for our speakers, I'll have a quick look in the chat and see if anything has popped up. Okay, let me just scroll back up to the top. Just give me 1 second. Brilliant. So somebody's just popping their own story in the chat, which is great, around starting as a carer in the 90s, given lots of learning opportunities, level 2 and level 3 MVQ, and working up to the senior deputy, to then become a registered manager, and now managing a care home, and then setting up a care home. Also now teaching the subject as a health and social care tutor in further education. Oh, that's fantastic. That's a really great career story. And thanks very much for sharing that. And now you're stepping aside as a careers advisor, working with the job centre. So that's great. Really great to have somebody that's worked in the sector, gone into that, developed the career, and now is actually encouraging other people to come and work in the sector. So does anyone else have any questions? If you do, please do feel free to pop them in the chat. So we've got a question from Sean. So is there any specific areas within care that recruitment is required? So I don't know whether Tracy or Debbie, whether you have any comments on that.
We actually have dedicated recruiters within each of our domiciliary care branches. So, you know, if they want to do further qualifications, not just in care, but in the HR side of life, we actually do, you know, sort of advocate that. That's really good practice. But yeah, we have specific recruiters within every branch. And a lot of the recruiters started off within care or HR, and they sort of blended it together and decided that whilst remaining in care, it's more of an administrative role. But from there, they learn all about the border control, making sure that people have got the right to work, the compliance side of life with the CQC. So there's a real huge career that they can build from being a recruiter within the business of health and social.
That's great. Thanks, Tracy. Debbie, I don't know if you want to come in terms of local authority employment. I think there are quite a lot of opportunities that aren't just those care-facing roles, aren't there?
Yes, so when I started at East Riding of Yorkshire Council, I'd initially started working for a private direct payments company that supported our direct payment service users who secure their own care packages. and then I came to work for East Riding of Yorkshire Council in the admin. So obviously, like, we commission a lot of packages, whether they are domiciliary or residential. So my job was actually to support and to make sure that those packages could get paid and payments were made to those providers. So I think, and that was just like one, you know, that was just the contracts department. We've got so many jobs that are not front-facing care staff, and we do. If you go on the website, you'll probably see so many jobs. We're constantly recruiting and filling spaces, flexible and part-time. So happy to talk to anybody about that if they want to drop me an email.
That's great. Thanks, Debbie. Let's see if any more questions come through. It's great. What I'm going to do now, hopefully if it works, is I'm just going to pop a quick poll in the chat. Hopefully that's going to work. Yeah, that should be in there now. So what this is just a quick evaluation and a way of us finding out how people have found the session. So if people wouldn't mind spending a minute or two just quickly completing that poll for us, that would be much appreciated, because that really helps us in shaping our future webinars. So while people are just completing that, I just want to take the opportunity to say thank you so much to all our guest speakers for their time today, and also to all those people that have taken the time to pre-record something for us. I'm sure you can appreciate it's really challenging getting people out of that work environment to come and talk on webinars, so they have given up their time to be able to record something that so that they can share their stories with you. For any more information around careers in health and care, do please visit our Careers Hub website. The address is on the screen now. There's lots of information on there around our career pathways. You can search and apply for jobs and apprenticeships, and there's some really useful guides for people who are wanting support with interview techniques and CV writing. Again, I hope you've all found the session useful in learning about careers in adult social care and the route ways in. And again, thank you to those that are completing the evaluation in the poll for me. That is really helpful. And what we'll do at the end of this session, we will download the recording and we'll embed it within the presentation, and that will be uploaded to our website. So you'll have full access to the slides from today and the recording to use at the later date. If you want to promote that out to colleagues or share that with students, then please feel free to do so. But just like to thank everybody for their time again today in joining the webinar, and I hope you all have a lovely evening.